Good afternoon and welcome to Ken Cable 21. You are watching a live show that's coming to you by Ken TV. During the next 25 minutes, we're going to be discussing palliative care versus hospice care. My name is Lucy Aquino, and I'm the Chief Executive Officer of Hispanocare, Inc., a program of Advocate Illinois Masonic Medical Center. And today, joining me is Nicole Russo, palliative care nurse practitioner at Advocate Illinois Masonic Medical Center. And thank you, Michelle, for being here today. I'm sorry, Nicole. Thank you for being here and allowing us to spend time with you.
Thank you for having me.
Well, that's great. I know that our show today is very, very important because this is something that lots of patients are talking about. And of course, that topic being palliative care versus hospice care. There is a difference between the two. We know that patients do have the right to make decisions about their health care, either for now and in the future. Federal law requires that you are told of your rights to make an advance directive when you are admitted to a healthcare facility, and the Patient Self-Determination to the Patient Self-Determination Act, which are laws and rules that are governed by the state of Illinois and in every state. So on that note, Nicole, what can you tell us about what is palliative care?
So palliative care is a program, medical specialty that focuses on quality of life and symptom management for patients, as well as being a liaison for patients and between them and the medical staff, and making sure that all of their goals and wishes are being addressed and met.
So obviously the goal of palliative care, as you mentioned, is about quality of life. That's such a big statement for such small words.
So what that means is that we really focus on making sure that patients, whether it's physical symptoms or spiritual symptoms or psychological symptoms, that they're all being addressed while patients are receiving their curative treatment. So for example, if a patient were to have cancer and undergoing chemotherapy and radiation, we would be there to make sure that they're getting all the supports that they need and all the side effects and symptoms that they have are being treated as well.
That's great. So, Nicole, palliative care and hospice care are obviously two different types of care.
Correct.
Can you please give us a difference in the descriptions of those?
So, palliative care can happen pretty much for any patient who has a terminal or significant illness that has a lot of symptoms that they need and that need a lot of support. But this can happen while patients are receiving treatment. Hospice is a benefit that patients who are no longer looking for curative treatment and just really wanting to focus on comfort, quality of life, and really trying to maximize their time and their quality and focusing on that only.
So, Nicole, on the hospice care part of it, does Medicare and Medicaid cover these services?
So Medicare covers 100%, Medicare Part A covers 100% of hospice. For palliative, Medicare Part A covers 80% of their services, and Medicare Part B covers the extra 20%. So both services are available to be and covered at 100% by Medicare for patients.
And Medicaid?
And Medicaid.
Okay. So it's really important because I know a lot, when we're out in the community and we're out there and we get these questions all the time about particular services. And as we have representatives at, for example, our senior health fair that's coming up this week too on Thursday at Advocate Illinois Masonic Hospital, even at those events, we constantly get these questions.
Right.
And sometimes it's harder for us to answer them because we're not the experts. Right. You are. And I know you guys will be there. So we're really excited about
we're very excited
having
to be
you there as well. But I know these are questions that are very important, and those individuals who are on Medicaid actually seem to think that type of service is not covered.
Every citizen, every person in America who is entitled to these benefits. So whether they have Medicare or Medicaid, they are or private insurances. Palliative care is not covered necessarily 100% by private insurances, but it is available to all people.
And obviously the goal here for both of these services is comfort.
Correct.
Nicole, who can benefit from palliative care versus hospice care?
So So patients that we often see who are benefiting from palliative care or using palliative care service are patients who have chronic, long-term illnesses that have a lot of symptoms. So we see patients with anything from dementia to congestive heart failure. We see patients who have cancer. Really patients who are requiring a lot of extra support beyond the standard medical treatment. And often patients who we see do not have necessarily a cure for their disease. We see often, like with dementia and congestive heart failure, they can be chronic illnesses. You can live a long time with them, but we can't cure them.
And during some of this care, obviously, I know that for many patients, special equipment, sometimes equipment is needed and things like that. Is that also covered as well?
During palliative care, unfortunately, it's not part of the palliative care services, but with hospice, all medical equipment, all durable medical equipment is covered by the Medicare and Medicaid for the patients. So all of that is also covered at 100%.
So important to know. I mean, this is such vital information for viewers, for those who are watching. Please know that our lines are open. If you have any questions that you'd like to have for Nicole or myself, please give us a call. The number's at the bottom of your screen. Nicole, I know as we're sitting here and we're discussing care, the importance of goals and care for individuals. I mean, this is something that we should all prepare for, and we should be talking to our families and physicians. So being said, what would be your first step? What would be your recommendations if someone found themselves in a situation such as this?
I think there are a lot of important steps. I think figuring out who is someone you'd want to make decisions for you. And I think that also a very important aspect of this is to know what treatments you would want. So to be very educated and get as educated as possible about whatever disease that you have, and talking with your family and your loved ones about how you would want to be treated and what treatment you would be open to receiving.
Absolutely. So Nicole, when you're admitted at a hospital and you find yourself with a family member in that situation, obviously needing to provide this type of care and plan for these types of things. And I know that later on we're going to be speaking with Mark as well, your coworker, who's going to be talking about advanced directives, which is so important as well. Something we definitely need to talk about and find out more about. But as you're planning on things like this, the patient has the right to ask for these things. The patient should be told immediately upon admission, right?
Definitely. So upon admission at every hospital, patients are asked in advance if they have advanced care directives, and a lot of times we see patients at Masonic because they or their family have requested to have us involved, that they're concerned that they want to make sure that their voice is definitely being heard by the medical team, and so families and the medical team respects those wishes. So families and patients should always feel empowered to ask for our services and help when admitted.
So when these conversations are going to take place, when should they be held?
I think that as early as when you're healthy, prior to a diagnosis of a chronic illness, I think is the best time, because unfortunately all of us are open and susceptible to tragedy and to severe illness that's unforeseen. So it's very important, even as a healthy individual, to discuss with somebody what your wishes are. And for example, I have had long discussions with my husband about what I would want to be done for me if I were in a situation like that. And so that's been really important.
And that's such a hard discussion to have, because especially when you start looking at our young, and we start looking at, we kind of feel like we're supermen and superwomen and nothing's going to happen to us. But believe it or not, statistically, we have more accidents amongst our younger population, and who don't think about hospice care, palliative care, advanced directives, living wills, and some of the other things we're going to be talking about later with Mark, is that these things should be thought about.
Okay.
And we should think about them now.
Yes.
We start looking at this.
We recommend to all of our patients that, this is something that should be done as soon as you turn 18 and are able to make those decisions for yourself, let your family and your loved ones know what you would want those decisions to be.
Absolutely. So, Nicole, who provides palliative care and hospice care services? Is that something that the hospital helps to select, or is that something that a patient, a family member has to do? How is that provided?
So inpatient palliative care, which is what Mark and I provide, is provided through the hospital. But then palliative care and hospice can take place really wherever a patient is. So it can take place at home, in the hospital, at a nursing facility. Palliative care can even take place sometimes when patients are receiving rehab. And so what we do if we meet somebody is kind of give them, there's many different outpatient and home services, and we talk with our patients about the different aspects of all of the different palliative care and hospice teams available to them, and then between ourselves and them try to find the group that's best suited for them.
Now, I know that Illinois Masonic is really on top of that, and we're very fortunate to have both you and Mark Epstein who provide this type of information, this type of care, and that knows to work around it. But many hospitals, all hospitals, should also have this type of support at each of their sites. So it's not just Masonic, it's every hospital. Whatever hospital you go to, whether it's St. Joe's or St. Mary's or Thorpe or Lutheran, it doesn't matter where you go. Every hospital should have representatives there to assist you with this type of care and information.
And the nice thing too, and when Mark talks about the advanced directives, is some of those can even be filled out with the chaplain services or even some of the staff nurses, so that patients don't even need to wait to see us. If they have paperwork that they'd like to fill out, they can be empowered to talk about that with anyone in the hospital that's helping with their care.
Oh, that's wonderful. Nicole, I want to share your information to our viewers. And at the same time, I know it's very, very important that, let me see if I can fix this over here. Oh, too small. There we go. But either way, here we've got Nicole Russo, who is the young lady speaking with today, and she is nurse practitioner, palliative care nurse practitioner at Advocate Illinois Masonic Hospital. If you have questions for Nicole, you can reach her at 773 area code 296-7427. Again, that number is 773-296-7427. And Nicole will be very happy to answer any questions that you may have in the event you don't get a chance to call in today. So joining me now is Mark Epstein. Hi, Mark.
Hi, how are you?
Thank you for being on the show today.
Thank you.
Now, Mark, you are also a palliative care nurse practitioner as well.
Right.
Yay for male nurses. Gotta get a whole lot more of those. But Mark, I know that we've spent some time, as you heard, we're actually talking about hospice care and palliative care. But most importantly, too, we need that advanced directive.
Right.
Now, you hear a lot of that now today in the medical world. I mean, every hospital you go to and every place you're in, nursing homes and rehab centers, people are always talking about those advanced directives. But you kind of look at them and you go, well, what the heck is that?
Right.
So, Mark.
So an advanced directive is a document that can be completed to help advise your loved ones and also the hospital staff. So that way we'd know what would happen if at some point in time you couldn't make a decision. And so that would be, there's any number of different documents. One is the power of attorney for healthcare, and the power of attorney for healthcare is probably the most important document, because that would identify the person who you would trust the most to make decisions on your behalf should at some point in time you become unable to make decisions.
Right.
And it's not necessarily the person you're closest to or the person you're married to, but the person you think would be able to make decisions for you the way you would have made for yourself.
Right. And that's really hard to determine, because myself as a mother, I know that I've done my advanced directive, and my children may never forgive me for this, but I didn't choose them. Only because I think it would be too emotional. And I think they'd be too close to it, to kind of like, what would mom want?
Right.
And what if we did this, and what if that's not what she wanted? Well, I've set it up. I've written it out. I've got it down pat.
Yeah.
And I've chosen someone who's a friend, And you know her, Reverend D. I mean, you know, I've chosen her because she's got that calmness. She knows me. We've talked about these things in detail. And find someone who is going to be there that can help console your family, but at the same time knows well enough to know what it is your wishes would be.
Right.
Because I just don't think sometimes, especially, you know, some children just can't handle things like that.
It's so
And-
true. In the
and
hospital,
some can, right.
in the hospital, we see that very often where, unfortunately, it's very fortunate that you completed that, and that's going to be, it'll be a big help to them. Hopefully, sometime way off in the future.
Yeah, I hope so too.
that if there's some guidance that's needed, that you've
Right.
taken care of that. But so often,
Right.
families don't have that. They say we've never had the kind of conversation
Right.
with mom or dad, that we have no idea what they would have want if.
Right.
What we should do at this fork in the road now.
But it happens so often. I mean, I
Right.
hear this all the time when we're out and, you know, even having coffee or out in community, we're constantly talking about these things, and we're just bringing it up just as a small topic of conversation. And as we reach out, even to, you know, even to our Latino communities, when we're out there, we're asking, you know, so have you guys ever talked about, oh my God, are you kidding me? No, absolutely not. I says, but why not?
Right.
You know, whether it's you or someone else, you need to talk to someone who's close, someone who knows what your wishes might be, but not just discussing it. There are forms that you can fill.
Right.
Right. Well, I want to talk a little bit about those forms.
Okay.
Now, I know that we have quite a few of them, and I know there's all these things such as your living will, your 5 wishes, your power of attorney, and so many other things. So I want to go through those real quick and
Sure.
see, Mark, what you can tell us about each of those, and what are some of the things that people should do.
Okay. So there's a number of similarities between some of the forms. In the power of attorney for healthcare, there's a section there where you can, where it's optional, where you can generally state the type of preferences you would want. Are you saying, would somebody think that the quality of life is more important, or is it the quantity? And there's more detail to those two sections. So that's a preference box that you can check. And that's really the indication, the briefest form.
Right.
So it advises someone as far as what general type of efforts would they want moving forward. There is also a living will. Living wills help to guide someone where if somebody really does not want heroic efforts undertaken, if they were not able to make decisions, and if that the healthcare providers thought that the burdens, the suffering would outweigh the benefits, the
Right.
burdens would outweigh the benefits of
Right.
medical treatment. The 5 Wishes is a very good document, and in that document, you're able to identify, you're able to state who you would want to make decisions for you, and also more detailed treatment preferences. And so there's these forms are available online. The 5 Wishes, I believe, but I know that the living will and the power of attorney for healthcare are
Right.
all available online.
Well, let me bring this up. I know we have a sample here of the, let's see if we can do this. It's the Illinois Living Will Act. And it's really important to our viewers that when you go online, and I'm going to give you the website in a second, Mark brought that with him, so we're going to put that online so you can see that. You can go online and get these forms as well. You can speak to hospital representatives, the chaplain's office, and things like that who can help you with that. Our nurses over at the hospital who can answer those questions for you as well. But if you're going to go online, this is what it looks like. And it's really, really important that you select one that says Illinois because you live in Illinois. Make sure you don't get the one from Indiana, or you don't get the one from Michigan or someplace else. Why? Because they do differ. Correct?
That's correct. Yeah, and they're recognized differently. I would say that as far as for anyone in the viewing public, you know, that you don't have to be too young to complete, especially the power of attorney for healthcare, because unfortunately, you never know when something may happen, and that decisions may have to be made.
Right, right. Really, really important. I know that too, that what's really, really interesting, you also have the do not resuscitate order. Can you
That's
talk a little
correct.
bit about that as well?
Right, sure.
Okay, and
So the do not resuscitate order is the only form that has to be completed by your physician or your nurse practitioner, or and that can be done in their office or in the hospital. So a lot of times people get confused with the terminology between these different forms.
Right.
They think that completing a power of attorney means that you're dying. So a do not resuscitate order, that is something that can be completed by, that's often completed with someone when they do have an illness or a chronic disease state where they can see that at some point in time they may wish to allow for less than the full range of medical benefits that can be done in the hospital. There's actually a form now. The old term is a do not resuscitate form, but now it's called a POLST form, Practitioner's Orders for Life-Sustaining Treatment.
Okay.
And in this form, you can specify. This is the be-all, end-all of forms as far as being followed and the legal weight as far as if something is done or not. This is the form that would actually be done to not undergo resuscitation.
Sure.
And you may ask, well, why would someone not want to do resuscitation?
Right.
Let's say someone has a advanced congestive heart failure or advanced cancer or any other number of conditions.
Okay.
And in those conditions, if the heart were to stop, that the efforts that we undergo CPR, which are very aggressive efforts, likely would not yield a benefit. And patients understand that the end of life comes for all of us, and they would accept that to allow for a peaceful landing.
And I think the key word there that you said that was critical. You know, if these are individual patients who are at life end, and to resuscitate and to put them through that if you don't have to. And some of those, I mean, those are decisions that patients make or family members have to make. But at the same time, you may not want that order if you know there's a possibility that's not the case and you can save someone. Of course, you're going to want to do that.
Of course.
But of course, that's again, this is why it's so important to discuss these things with those family members amongst yourselves.
Absolutely.
Over dinner with family. Bring up that topic. So important to discuss it.
It can't emphasize it enough.
Right. Very, very important. So I know that I do want to share with our viewers, Mark, that we talked a little about the site in which they can go to get more information. And I think it's really important for our viewers to pull that up. Let's bring that over to them so they can see that as well. And Mark, can you talk about what these are?
Sure. So these are just a couple of websites you can go to. The first one is the Illinois Power of Attorney for Healthcare form. It shows there, I know it's a lot of things to do. Basically, the easiest thing is to go to Google and type in Illinois Power of Attorney for Healthcare or any of the other forms, Illinois Pulse, DNR. You'll find all these resources.
Right.
And so that'll help provide you direct links to the form. And these forms can be done at home. They just seem to have a witness also, and the forms detail who would that be.
Now, I was told it was a good idea that sometimes when you do these forms and the advanced direct forms, to have someone witness it that you don't know. So if you have a notary, get somebody who's witnessing it there and things like that, and then to get several copies.
Yeah, it doesn't even have to be a notary. It could be. I mean, it could be the ice cream man or something. Just someone.
True, but I heard that if you get it notarized, and God forbid that you're at some other state and something happens, other states may not recognize it because it's not notarized.
Other states they don't have to recognize another state's form. But I think that even if you do the form, and even if it's not, I think that just having a form done is going to really show that this person put effort into doing this.
Right.
And so let's say you live on the Illinois-Indiana border or wherever you might be, or by Wisconsin, that just having the forms done is with a witness that can be tracked down, so that way they can verify that.
Absolutely.
That'll help a lot. And certainly notarizing it, there's always the benefit of that to help eliminate any questions.
See, I'm just one of these individuals. I want to make sure I cross my T's and dot my I's. So this way, if anything does come up, we're here and make sure we're on top of it. Right. Mark, our time here goes by so quickly. Yeah. It's like we can talk about this and keep talking about it, but it goes by really fast. So I want to extend an invitation both to you and Nicole to come back and let's continue talking about these important things, because it's so important for viewers like yourselves and even us. I'm learning every day. I'm learning new things. So this is wonderful to hear more about change, and there's always updates and changing of forms and things like that. So we always like to keep you informed.
Yeah.
Thank you so much.
Thank you, Lisa.
So I just want to remind our viewers that, you know, you should talk to your family members, your healthcare professionals, your attorney, and any agent that you appoint about your decisions to make one or more advance directives. Cannot emphasize it enough to echo your words. And it's definitely something that we should all be doing. So on behalf of our colleagues at Hispanocare, at Advocate Illinois Masonic Medical Center, Nicole Russo, thank you from Advocate Illinois Masonic, and Mark, thank you so much again for sharing this important information with our viewers. And of course, Illinois Masonic has just been absolutely wonderful in the work that they do for community, by community, and in community. Thank you so much. My name is Lucy Aquino, and I represent Hispanocare, a program of Advocate Illinois Masonic Medical Center. And thank you for watching Can Cable 21. Until next time, we invite you to stay tuned for more information coming your way in the next couple of minutes. See you soon. Thank you so much, and have a wonderful afternoon or evening. Thanks.
Thank you.